Hey guys, how's everybody doing? Let me get this figured out here. Welcome to No Crime, No Time community. And I feel like we have the time to kind of get together right now and talk about some statistics that the CDC has released, as well as what as a society we've already been through with the H1N1 influenza swine flu, and what the differences are and what the mortality rate was with that, um, and compare it to is are we at higher or greater risks with the COVID-19. And so I found us some answers, and I wanted to share that with you guys. But before we get into that, I'm a mom. I'm in healthcare. I'm in the heart of Wisconsin. And I want to tell you, I'm taking this extremely serious. And it's not because I believe in hype. Yeah, the media went with it pretty quick. I feel at this point it might be a wise choice to take all precautions. So, you do need to stay home unless you have somewhere very important to be. There's no reason to put anybody else or yourself or your family at risk. We have a lot of benefits and things to be grateful for in this day and age with this, quarantine that we're kind of volunteering to do and also complying with. Now, in Wisconsin, the restaurants are closed except for drive-through. The bars are closed, taverns and such. Healthcare, we're at the status of currently, as of this morning, schools are mandatorily closed by the state of Wisconsin Governor Evers. We have been instructed locally that our children are on spring break until next Monday, and at that point, they will be doing online schooling. There will be meals available to pick up at the lobby. They will be bagged and set forth. You can pick them up if you're local. At a lot of the schools, just contact your school representative for the times and the dates that will be available. Locally, if it is during spring break, the meals are not available until Monday. Otherwise, like I said, contact your school. A lot of our clinics are being, our appointments are being canceled if they are elective or not priority. So a lot of my clients are not getting rescheduled. Their appointments are being called, canceled by the provider. As far as precautions that we're taking, most, and I would venture out to say all at this point, of our local area, for our clinics, hospitals, and so forth, it is an emergency basis only. Those allowed into the facilities are the workers, and only that. No family or friends or visitors are allowed into the locations that I'm aware of. And there are postings on most of the facilities on the exterior to let people know. They are on what's literally a lockdown, where the doors are locked and people are allowed in after they're recognized. So that's where we're sitting. I'm a little chilly. I turned my heat down a little bit, just enough to where I need a blanket. I think with a lot of us home, we need to conserve energy as well as take care of one another, So anyway, that is where we're sitting. It has not hit our area directly. We're going to get into the cases in the United States as well as Wisconsin. But first, I wanted to start off with acknowledging swine flu was also an epidemic, and it affected a vast number of people, but there are some differences, and they're quite alarming. Okay, so H1N1 influenza swine flu tends to cause high more I can't say this. I say mortality. It says morbidity. I can't even say it, but low mortality rates. So 1 to 4%. So keep in mind, we're only looking at 1 to 4% of mortality for H1N1. And this has the COVID-19, as we get into and we read, I believe it had, let's look over here at it. Let's see what the rate was. For COVID-19, I believe it is 7%, so almost double. But let's see if we can't find it right on the site. Now, this is at the cdc.government coronavirus / 2019 so forth update, and it's cases in the U.S. is the tab I'm on. And we're going to get into this. I just wanted to see if there was a percentage rate. It's almost double. I believe it was 4 to 7% of the mortality rate. Now, some of the differences between the H1N1 is they go on through this and they say that the age affected the really young, but the elderly did not seem affected by it. I think it's on this one. I just did a whole bunch of research on it. So, okay, let's read this. This is on the coronavirus, the latest information on the coronavirus, also known as the Wuhan flu from Johns Hopkins University, shows widely varying numbers of confirmed cases and apparent mortality rates by nation. The People's Republic of China, the virus epicenter, was reported 81,058 cases as of March 17th, with 3,230 deaths, with 4% of those diagnosed subsequently dying. Italy is similarly hit hard with 31,506 cases and 2,503 deaths for a mortality rate of 7.9% of those diagnosed. So that's where I guess it'd be 4 to 8% death rate. Now let's go back. If we've got, let's go with the highest death rate right now. Let's just say we do have 8% deaths, okay? If we go back and we look at H1N1, they had 12,469 deaths. So that's at 4%. Is what they reported, about a 4% death rate. So we're looking at an 8%. So you can't just double this, I don't think. I'm not sure how to do the math, but you guys, you can see it's going to affect thousands and thousands. Now, like I said, H1N1, the swine flu, it affected the younger generation. It goes on to say fewer young people had any existing immunity as detected by antibody response to the H1N1 PDM09 virus, but nearly 1/3 of people over 60 years old had antibodies against the virus, likely from exposure to an older H1N1 virus earlier in their lives. So now this COVID-19, it's affecting the elderly as well. So that could be where we're seeing the higher percentage rates. We need to take this extremely serious. We don't need to overreact. We need to take care of each other. We need to take precautions. And we need to know what those precautions are. So let's go over to the cases in the U.S. Let's look at this at a CDC at a glance, okay? We have currently, according to this, as I believe it is updated this morning. No, I'm sorry, this was yesterday morning. So this will be updated at 4 p.m. today. So at 4 p.m. you can come back to the site and you'll be able to tell how much has grown. If you need to look back, you can use this video as a reference. So we have total cases in the U.S. of 4,226 souls. We have total deaths of 75. Jurisdictions reporting cases 53. 49 states, District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands. Data include both confirmed and presumed positive cases of COVID-19 reported to CDC or tested at CDC since January 21st, 2020, with the exception of testing results for persons repatriated to the United States from Wuhan, China, and Japan. State and local public health departments are now testing and publicly reporting their cases in the event of a discrepancy between CDC cases and cases reported by state and local public health officials. Data reported by states should be considered the most up to date. So that's something we will be looking at. Keep in mind, they're just now starting testing, so we really don't know the amount of cases out there. Travel-related reported to the CDC is 229. Close contact is 245. Under investigation is 3,552. Total cases up to 4,226. It does have a little crossbar. It says CDC is no longer reporting the number of persons under investigation that have been tested, as well as PUIs that have tested negative. Now that states are testing and reporting their own results, CDC numbers are not representing all of the testing being done nationwide. So these numbers are extremely low because they are not getting firsthand. They are not up to date. But we're going to go ahead and look at this from the perspective that we are looking at the lowest possible infection rate currently, because this is a day old, 24 hours old. The testing was just getting going, so we don't know how many cases we have in the U.S., as well as states are now starting to test, and they have not reported their reports to the CDC. As you can see, the darker areas, such as Washington, ranges from 500 to 1,000, as well as New York, California coming in third, with over 200 to 500 cases reported. And if you look, there are no reported cases in North Dakota, Wyoming, Idaho, Iowa, or West Virginia. There is a circle here in Washington, D.C. They have reported 17 cases, and they have undetermined community transmission. In Wisconsin, we have 11 to 50 reported here, when it was reported that we have 1,000 in Wisconsin, I believe, on another site. So these numbers could be extremely low. And the community transmission is undetermined. This started with the Wuhan, China. They had 3 positive. The cruise ship, 46 positive. And those are confirmed. In the United States, this is what I want to show you. And then we're going to go top side. I want you to pay attention. January 12th, and then on. Look at I'll start reading the numbers. Okay, we'll go back. For those of you that can't see the screen that good. January 14th to 16th, 1, 21, 21, 1, 22, 1, 24, 1, 25, 3, 28, 2, 29, 1, 1, 1, 1, 1, 1, 2. We hit February. Here we go. February 1, 0, 1, 0, 4, 4, 0, 3, 1, 3, 2, 6, 9. So on the 17th of February, it starts to more than triple. It's 9, 6, 17, 21, 15, 41. On the February 24th, we've gone to 8 times the amount. 25th has got 30, 47, 36, 53, 50, 74. So on the 1st of March, it takes a jump. 76, 85, 90, 78, 77, 69, 87. On the 9th, and that's the last reported date that they have recorded data that is accumulative, we had 113 cases in the United States. This is spreading like any normal flu, and we know a lot of people get the normal flu. The difference is that out of every 1,000 people, we have 4 to 7 people will most likely suffer fatality. Or even worse than that, isn't it? Out of every 100, if it's 4 to 7. If you get this virus, if you get this virus out of 100 people, most likely 7 people are going to die out of every 100. If it's at 4 to 7% mortality. That's horrific. So yeah, we need to take this serious. So let's go over here, how to prepare. All right, then we're going to get into symptoms and testing, but let's go topside. All right, hello everyone. We're going to take a breather from the information. Hi Ricardo, Edna, good morning love. Justin, sorry I'm not in my cheerful mood. Obviously, it's not the best topic I want to be talking about. Justin says they are locked down here, just hopping out for the essentials. Justin, you wearing gloves, I hope. Keep mask on if you can. Keep your distance. Only do social environment through internet. Hi, Cyan. Yeah, Cyan's talking about Sean Atwood. I do watch Sean Atwood. You guys, this is serious. The flu spreads. We all know that. This past year, everyone I knew was sick. Everyone I knew at Christmas was sick with the flu. They had either influenza A or B. This is how this will spread if we do not take the precautions. We have control of our destiny here and how we control it if we take it serious. This is not the swine flu where the elderly were mostly spared. 30% were already had the immunity to it, the antibodies in their blood, okay? That also helped them get a vaccine to calm it because there were immunities built in the system. So far, no one seems to have immunity to this in a real sense of the word. Hi, Rich. How are you? Hey, Shane. Yep. Yeah, this could be the bat flu, right? I think it's interesting that H1N1 was 09 and this one's considered 19. So you see a pattern of 10 years, almost to the day. The first time H1N1 it hit our kids. It hit our little ones more than anybody else. It targeted those, which are the most vulnerable. Now this is targeting those, as well as COVID-19 is also targeting our elderly as well. So in the next 10 years, I predict personally that we will see a full-out pandemic that attacks the earth, no matter what the age is, just because of the history unseen. Let's see here. Shane says, my mother is 76 and has been told to stay home. We all need to stay home if we can. A lot of us are working from home. My facility is now doing all reporting online. I do have to go into work, but it's a lockdown facility where I transfer from my house to my car straight to work. I'm not allowed to go out into public and things of that nature other than to buy a few supplies, and I have to take complete precautions. I try to go when I see the parking lot is less full and so forth. I sanitize my mail. I sanitize the things that come from the store. I'm not ordering online anything that would come from overseas, so basically I'm not ordering online. We're not accepting packages or anything that isn't medical supplies at this point, just as precautions. It isn't even here yet. It's just we want it stopped, and this is the best way to get it over as quick as possible. The more we respond quickly, the longer that we have to really look at this from a quarantined perspective to get it under wraps and provide time. It buys us time. It buys us as much time as possible. I'm not saying to overreact and buy all the toilet paper so that nobody else has any, you guys. There will be more supplies coming into our shelves. The stores, if nothing else, the stores will be allowing restricted shopping hours and such that we can still get supplies that are coming in. So, share with your neighbors if you have it. I see people going out for walks and stuff. If you have to walk your animal, I would keep it to your vicinity, your property if possible. For those of you that can put your dog out on a lead or such, I would recommend it, even though dogs have been cleared of transmitting the virus. Other animals have not been cleared. So, okay, guys, let's go back over. Right, Cyan says some people are catching it again, even worse, not becoming immune. That is a concern, so we're taking very strong precautions. Lisa says, hi all, blessing, this beautiful morning finds you and yours as well. We love you, Lisa, and your positivity. You bring warmth into our heart. And, we're all very investigative. We stay on this. We're looking at it. We know that with the H1N1, we were looking at a 1 to 4% mortality rate. It wasn't affecting the elderly. It was very, very serious. We took precautions. We were able to overcome it. This virus, COVID-19, it is affecting our elderly. It is affecting our youth. And the mortality rate is double. And so that is scary. Now, it was reported with H1N1 that over 12,000 had a fatal rate. Now the question is the infectious rate higher with COVID than it would be with H1N1? That's something to be determined over the next few weeks. Unfortunately, the data has not been collected enough yet on this to present that information today. So that is the scary part that we're asking, is what is the infectious rate right now out of the population? If you look at in the last 10 days, let's go ahead and look at that real quick. Let's see, here we go. Give it a minute for the computer to disinfecting your home if you are sick. Let's see, where did I have my information? Okay, reported cases, you guys. We've got over 4,000 cases since January, and the most of the cases have occurred since March 1st. It doesn't give us a history to compare that to H1N1, though, because it's not enough information. So, Master Cedar, good morning to you. Current cases in the U.S. is, okay, here we are. This is a much more up-to-date reading. We have 7,387. So that means in the last day we went almost 3,000 cases more, like 2,800 cases have been confirmed. And we have 116 deaths, which means it's up about 60%, because we were about 50 deaths, I believe, yesterday. Good morning, Vanessa. Hi, all. Hope you are well and safe. Thank you, Vanessa. Hi, Brambler Teaser. Good morning, Rubber Ducky. Thank you. Let's go ahead. I jumped ahead a little bit. Bean says, a hospital where I work in the UK put NHS signs up to say they aren't testing people, so the figures will be way off in truth in the UK. Yes, we don't really know what kind of cases we have, so we need to take the precautions. H1N1 could have been much more serious if we did not take the serious precautions that were taken. Herd immunity Vanessa says, aka absurd immunity. Wherever herd immunity, there is always money involved. Vanessa says UK and Australia are trying herd immunity. Edna, bless your heart for doing this live, my friend. Yeah, this isn't my funnest topic, I'll be honest. I go through moments of feeling like this is like time for us as a society to grab hold of our families and start having meals at the table. We need to look at each other and learn what we're about. If you're not hugging your kids, you better start. This is a time where we're to learn that this is a joy and a blessing to have each other in our lives. And if you're in that place in your life where you've gotten so busy, it's time to step back and look at it and say, time to bake with my kids. It's time to play video games with them. It's time to paint my house, make it a better place to live. I don't know, just spend time with your loved ones, enjoy them, and take the precautions necessary to keep them safe. Canned goods is a great idea. Bottled water if you need it. Toilet paper is good. Doesn't mean you need to overstock on this stuff. Just stock up. Make sure you have enough for a few weeks that you can get by if needed be. Just like if this was a hurricane or any other brace. Okay, let's say, compare this to, what if we knew that a tsunami had hit China? And the backlash is coming back. We don't know if it's going to be bigger, smaller, whatever. We still know to go to the higher ground, correct? You know to go to the higher ground. Those still down on the beach swimming when a tsunami's coming, it doesn't make any sense. It might only come up 10 feet. It might come up 100 feet. You don't know. It's unpredictable. So you just need to, take the precautions necessary. All right, guys, that's about it for today. I just wanted to go over and explain that in what I'm seeing and so forth, that H1N1 was at a 4% fatality rate, whereas the COVID-19 is double that. So that is basically where we're at with our research today, and I thank you all for tuning in. Stay very positive. Hug your loved ones. You guys, we're amazing as people in our love for each other. Strangers do things for loved ones strangers do things for other strangers, and we treat each other with great respect. Yes, there is a group of narcissist assholes on this planet. We all know who they are, and we basically just deal with them, right? But in general, think of sharing some stories with each other that are uplifting, such as one time we were on a train trip. The train broke. We didn't have air conditioning, which meant that they couldn't refrigerate the food or sell it. We were on this train for 20 hours straight because it had some brake line issue, and it couldn't go over 30 because it had to keep hitting the brakes to stop. And so here we're sitting with 12 little kids, all different colors, right? Didn't matter what color. We passed the basket. We put all the food in the basket. For those 20 hours, it was a miracle that we all just shared and had fun and enjoyed it. But we took the precautions necessary, that all the kids stayed fed, they stayed warm, they stayed entertained, and we shared songs, we shared funny stories, we shared our time together. That's what we need to do with our families. So, all right, guys, that's it for me. I love you with all my heart. I know it's a different kind of podcast, but this is what we got. I'll be stopping in. I'm going to be trying to get more up-to-date information than the CDC, which is scary that we can't rely on the CDC to have the proper data, that it's more online. Bring your information to the table so that we can share that with everybody. If your country's being affected, you can share with us those stories. Next time, we're going straight to the live, and it will be nothing but conversation. Thank you, and have a great night. Stay safe. Wash your hands and be well.